Welcome back, everybody. So, as the numbers of COVID-19 infections go up in Sub-Saharan Africa, a group of local medical doctors calling themselves the Scientists Collective have written a document called Anticipating a Second Wave and When and How South Africa Should Try to Prevent or Mitigate It. One of the contributors joins us now, Dr. Aslam Dasoo. He's the convener of the Progressive Health Forum. Dr. Dasoo, great to have you. Thanks for your time this morning.
Good morning. Great to be here.
Given that we know there was so much conflicting information about COVID-19 in the beginning, and given that there has been a trust deficit because of this, which has done nothing but, I suppose, frighten a lot of us, what is the first thing that you would want us, the public, to understand?
Well, the first thing the public needs to understand that the course of the pandemic is in their hands entirely. That the only effective measures against the widespread occurrence of this illness is for the public to take the measures that have been outlined for non-pharmaceutical interventions, and you know them well: masks, physical distancing, hand hygiene, etc. And these are the only measures we have currently in our toolkit to limit the rate and the extent of transmission of the disease.
So that's the long and short of it, is that this is our responsibility. It is all up to our behavior, how we abide by regulations that have been put in place, and how we respect other people. Because genuinely, I mean, we've heard this, that wearing a mask is basically showing respect to those around you, because that's the one method we have that can stop the spread of this. Is it working, though? I mean, when we look around the world and we see these rules and regulations put in place, has it worked? Is it working? We're seeing second waves everywhere at the moment.
It has worked. It does work. It's working now. The evidence is clear on this. And if you just take a step back, this is all very common sense stuff. For example, we understand that this is an airborne virus. So the droplet spread by which it's transmitted, both the large and the small droplets, have an effective distance of about 2 meters. And so it makes perfect sense that you need to stay at least 2 meters away from another person who may be infected to avoid getting infected. Simple, very straightforward. Wear a mask. Whatever you may think of masks and whatever you hear from fringe groups and lobbies, etc., a mask is a physical barrier to the expelled air. Now, different masks will have different levels of efficiency, but even if a mask only prevents 50% of virus passing through, that will have a dramatic impact on the overall rate of transmission.
Yeah.
And then, of course, there's the usual hand sanitizing and washing, especially with soap, which dissolves the virus very, very effectively. So these are measures that are completely understandable, even to children. So adults have no excuse for not practicing this.
Yeah. And
more importantly, these are things everyone can do on an ongoing basis, and we will impact on the transmission of the virus dramatically if we do this.
I want to clarify something, because I remember right at the beginning when the COVID-19 outbreak occurred, there was talk that this was also something that was spread through touch, that you could pick it up from surfaces. We obviously know now that this is very much so airborne. But in terms of the touch and going shopping and touching things and sanitizing everything and picking it up from just touching people, is that confirmed or not confirmed?
No, that is confirmed. And again, it's perfectly logical if you think about it. If there's droplet spread from exhaled breath, from a cough, from a sneeze, those droplets will eventually drop to the floor. Gravity works, right? And it will land on surfaces. The virus in the droplet is viable. So if you touch that surface, get the drop on your hand, then touch your face, go near your mouth or your nose, you could potentially get infected. So it's a very simple transmission process. And I think the sanitizing of surfaces is justified, especially in high-touch areas and where there's a lot of people passing through.
All right. So, I mean, that's important because we are seeing that people are becoming a lot less relaxed about these kind of things. And this is where we are seeing a slight uptick in the infection numbers. I mean, we were doing exceptionally well when we saw South Africa opening up, but now we are moving into a space where there are at least 1,500 infections per day, going up and over 2,000. Are you concerned about the rise in infections in South Africa?
I think the surveillance indicates that there may well be an uptick, and this would not be surprising, given that we have reduced the restrictions and there's a lot more activity. People are moving around, the economy is opening up. So that's not surprising at all. We are currently actually at a very low rate of transmission compared to where we were. And all this means that the virus is still circulating. It's not as virulent, but as people get complacent about these non-pharmaceutical interventions, and people need to start using this term more and more, NPIs, and as we get complacent about utilizing these, we will find that we will be infecting each other much more frequently. And there may well be a resurgence at some point if we do not adhere to these interventions. We will not have a resurgence if there is diligence in complying with these measures. And, it's the fact is that we can't go into a lockdown again. That would just be absurd. But the first lockdown also did not have the desired effect. It simply pushed out the rise of the curve of infection, but we got the infections nonetheless. And this is the way viruses work. So lockdowns are not in sync with the biology.
Yeah. That's interesting. I want to pick your brain on that a little bit, because we are seeing in Europe that many countries are going back into lockdowns, that even though there is evidence that lockdowns don't necessarily work, what they really do is destroy economies. And we've seen that. We're living that right now in South Africa. However, we're still hearing threats. We're hearing threats from our health minister. We're hearing threats we saw the premier in KwaZulu-Natal. We're running that in our news. The premier there saying that he agrees we could, if we don't behave ourselves, go into another hard lockdown. The president also, I was at a function with him this weekend, saying that there is a chance that he needs to come out and speak to the nation, because the warning signs are there, the infections are increasing, and we don't want to see ourselves going into another lockdown. It seems that it's still on the cards for South Africa, that if this infection goes higher again, we could lock down. But you're saying that this actually doesn't work.
Well, let's look at it like this. In settings and countries where there are high economic and social support resources, targeted lockdowns of what are called hotspots may well be justified in order to prevent further spread of these hotspots to other areas. But that's just at one level of principle. The kind of lockdown we had, this hard lockdown, all it did, and I'll repeat this, all it did was delay the onset of the wave that we saw in July and August by a few weeks. That's all it did. But its other effects, the collateral damage, was devastating. And so even on a balanced cost-benefit basis, there's no justification for something like that. Obviously, the lockdown is based on a mega principle of physical distancing. It just stops people moving around. And so perhaps you can obtain some break in transmission for a while. But if you don't have an economy and a social support structure that can take care of the populace, in the meantime, you're in big trouble. And here's the thing, the infections will occur once the lockdown ends. So the utility of lockdowns is in serious doubt. There's no question about that.
Yeah.
And one more point, and you phrased it actually quite correctly, that it's a threat, that the governments threaten people. Why would you need to threaten the population? In high-trust societies, like the Scandinavian countries, for example, the populace trusts their government. And when the government makes recommendations, they tend to follow them. Mm-hmm. That's not the case here. So your communication with the population has got to be changed. I was watching an insert on your channel earlier where people I think it was in Mangaung, was saying, there's no COVID here. Tell the president we're okay. We don't need to wear masks. And for me, this is quite interesting because these are intelligent, seemingly educated people who have not got a message that has been going for months and months. And it is possible that the way we are communicating is not reaching the people. So a review of our communication approach is an urgent necessity in order to build compliance in society.
Yeah, you're not the first person to say that the communication is something that we need a lot more of, because people tend to be ignoring this and thinking, we're fine, not a problem. A 90.3% recovery rate, we don't have to worry about that. What we do have to worry about, and Doc, maybe you can also give us a little bit of insight into this, is that people think that you'll get it, then you get over it, and you're fine. A lot of people are fine, but there is also this issue of long haul. And the fact that a lot of people are suffering because they did get it, and now there are symptoms that are only now being discovered, and people are really, really struggling. I mean, that is honestly the risk of getting coronavirus, is what actually happens to you in the future. What are your views on something like this?
Well, I think you're correct. I think people they underestimated the virulence of this virus and the effects on the body. Look, it's a novel virus. It hasn't even had a full year of circulation. There's a lot being learned about it, but there are certain principles that we understand epidemiologically and medically about the virus. It's important that people understand that the recovery rate is actually a meaningless number. It's the fact that people get infected. Some will get sick and some will die. And this is an established fact. Now, you may be one of the unlucky ones who gets very sick or dies. And you have no way of knowing that it won't be you. So it's hard to understand why people would feel, let me just get infected and I'll be fine. That's completely irresponsible. Pretty much like saying, let's stop all these interventions and let the virus circulate to the population, get the people infected and get to a level of immunity that will make it go away. That is the most absurd proposition, unethical, unprofessional, and shouldn't even be considered at all.
Yeah. Issues of herd immunity. I mean, is there evidence that this actually happens? Because I was reading in your article, you were saying that there was reference to areas more protected because there have been more infections. Perhaps you want to talk about this as well.
Sure. So it's important to understand this term herd immunity. And I have to say that there has been a lot of medical jargon thrown out into the public without full contextualizing. I think people get confused with all of these figures and graphs and so on. Herd immunity is an endpoint that of generalized immunity, a threshold is reached, where the virus's capability of transmission is severely curtailed and even interrupted. And that's an epidemiological phenomenon that we know that is actually generated by vaccination. So if we are looking to get to a level of sufficient immunity in the community by simply just letting it circulate without worrying about anything, we will cause a lot more deaths and a lot more sickness and in the ensuing months. So this feared surge in infections may well be realized much sooner than we think. Unfortunately, there's no getting around this. And the way you would reach the so-called herd immunity is through widespread vaccination. And that really is the only intervention of any use to get us beyond the epidemic and pandemic, except for eventually that the people always overcome pandemics simply by owning. Yeah. And this has been proved throughout history.
Talking about a vaccination and progress towards that, where are we at? Because we're hearing that there could be quite a significant announcement coming out with regard to one of the vaccine trials that has been carrying on. Where are we at? I mean, when do you foresee that there will be a vaccine and a reliable vaccine to assist?
Well, I think, first of all, people should curb their enthusiasm about when the vaccine might arrive. Everyone is hoping that it arrives in the next few weeks. It may. There's no way of saying for sure that it won't. But there are a number of vaccine candidates in final phase trials showing a lot of promise. And so it is completely acceptable to expect that we will have a vaccine sometime in the early part of next year. But its availability is another matter, especially for countries like South Africa, who have to decide whether they're going to join the global WHO COVAX initiative or make bilateral arrangements with pharmaceutical companies. These are complex matters, and there's huge costs entailed, huge logistical issues. So realistically, it would be prudent to expect that vaccination to any meaningful extent will only begin in the second half of next year. And just to come back to your earlier question that I missed, you suggested that, and I've made reference to our article, which said that there are certain areas which may get harder hit by any possible resurgence. This is true because the densely populated urban areas took the brunt of the first wave, the peak of the first wave. But that actually created a lot of immunity in those settings. There were areas that it's hard to say because the figures may not have been accurate, but like the Northern Cape and Limpopo, where the infection numbers were quite low. And if that is the true situation, then we can expect that any resurgence will be more keenly felt in those areas. So what we need to do is urgent, what we call seroprevalence studies, like they did in the Western Cape, and they found that up to 40% of the population had antibodies, and so therefore, had some level of immunity. We don't know what it is throughout the rest of the country.
Yeah. Dr. Dasoo, I want to just look at some scientific and significant scientific information that the infection rate has been different in South Africa in comparison to European countries and that of North and South America. I mean, we are seeing such bad resurgences here. I mean, just the World Health Organization reporting new daily cases, record cases in one day. I mean, 465,000 cases on Saturday alone, 50,000 in France, Italy moving into the strongest lockdown that they've had since spring. The numbers are soaring all over Europe. Are we different? Why are things very different to Europe than they are here? Is there scientific evidence, or is it not really different? It's just exactly the same.
Well, it's possibly the latter. You see, we're not unique in any way. We did have a lag on our epidemic here from the Northern Hemisphere. So this lag is still in place. So what's happening in Europe may well be our fate. And what's happened in Europe is quite explicable. They went into their summer holiday period. There was absolute complacency, especially among the younger generation, where there was a lot of mixing without masks, etc. And then people returned home carrying infection and started a resurgence. It's very hard to compare head-to-head among countries because they have different age profiles, different genetics. There's demographic issues. There's also economic and social positioning that alters it. And so it's almost impossible to make that comparison head-to-head. But overall, the principle's the same. So, for example, we're heading into the festive season, and people will want, certainly after a year we've had, will want some relief and respite. But alongside that often comes complacency. So people get less inhibited about crowds, about moving around, and about wearing masks, keeping their distance, and so on. And it's likely that we will have a surge in infections as a result of that. So it's important. We've got time now to get the message to people. People are going to be going to various parts of the country. Some go home to the rural provinces. In fact, the large majority of South Africans and those who are fortunate enough to take holidays will also be moving. But everybody has to do exactly the same thing. Now, these measures are understood by grade 7s. I know, we have tested this. And if they understand it, adults have no excuse. You have to do the non-pharmaceutical interventions if you want this country not to experience the kind of resurgence they're seeing in other places.
All right, Dr. Dasoo, pleasure speaking to you, and thank you very, very much for that advice. We're ending off here, but I need literally a one-word answer from you. I know that there's speculation that South Africa could see a second wave come February, March. Predictions correct?
It's possible.
Yeah.
But remember, if there's one thing you have to understand, when we had the HIV/AIDS pandemic, we put in we made sure people understood you have to change your behavior and you have to use condoms. Masks are the condoms for COVID-19. Use them.
We'll leave it there. Dr. Aslam Dasoo talking to us. He's one of the contributors, calling themselves the Scientist Collective, who wrote a very informative document called Anticipating a Second Wave and When and How South Africa Should Try to Prevent or Mitigate It. Well, that's where we leave it for today. Thanks so much for all of you for contributing to our question on social media. It seems